This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Media Briefing. This is a Q&A about vaccine. It is being aired live on YouTube. And joining us today are DHS Deputy Secretary Julie Willems Van Dijk and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and a part of our COVID response team. And we will begin today's briefing, as we do, with remarks from Deputy Secretary Julie Willems Van Dijk.
Well, good afternoon, and thank you for joining us. As of today, 1,466,654 doses of COVID-19 vaccine have been administered in Wisconsin. 510,239 of those are second doses, which means 510,239 individuals have completed their vaccine series. Well over half of Wisconsinites aged 65 or older have received their first dose. We are among the top states in the nation for the percentage of our allotted doses that have been administered. The national average is 78%, and we are at 93% administered. The numbers tell an impressive story, but the impact goes even further than the almost 16% of Wisconsinites who have received their first dose. Just like we heard stories of relief and gratitude from our healthcare workers early in the vaccination effort, today we hear stories from family members who are grateful for their grandparents' vaccine and neighbors who are relieved to know their older community members are protected. And with more Wisconsinites now eligible after March 1st, and another vaccine found to be safe and effective and authorized for emergency use, we know more and more of you will be able to receive vaccine and tell these same stories. As of yesterday, more groups are now eligible for COVID-19 vaccine in our state. To be clear, if you were eligible before, either as a frontline healthcare worker, a resident or staff of a long-term care facility, police and fire personnel or correctional staff, or an adult age 65 and older, then you are still eligible, and we encourage you to get vaccinated. In fact, you are still the priority, even as we expand eligibility to ensure our vaccinators can plan ahead and maintain the pace of administering vaccine. Beyond those groups previously eligible, we are now prioritizing education and childcare staff first, and then individuals enrolled in Medicaid long-term care programs, some public-facing essential workers like 911 operators, public transit workers, and grocery store workers, non-frontline essential healthcare personnel, and staff and residents of congregate living facilities. If you are looking for more information, you can visit the DHS vaccine page by going to dhswisconsin.gov/COVID-19 and clicking on the vaccine button. That page will give you the option to learn more about your eligibility and next steps, as well as provide information about the vaccine registry and a map of vaccine providers currently receiving allocations. Over the weekend, the FDA issued emergency use authorization for the COVID-19 vaccine developed by Johnson & Johnson, and we expect to see doses in Wisconsin by next week. The addition of this vaccine gives a significant boost to our vaccination efforts. As we've been saying since the beginning, we need more federal allocation, and the 47,000 doses of this new vaccine set to arrive next week is a strong step in that direction. The Johnson & Johnson vaccine is also easier to handle because it only requires refrigeration and not ultra-cold storage. It can be shipped directly to any vaccinator in our state. Also, it's a single-dose vaccine, which makes it more accessible to you and less burdensome for both you and our vaccine providers. We will be adding the J&J vaccine into our allocation process, so providers around the state will soon be administering this vaccine. with our first group of 47,000 doses focused on our educator allocation. All of this boils down to a key point. Having more doses available to us means that we can vaccinate more people. And the more people who get vaccinated, the safer we all are. We have built an impressive vaccination effort here in Wisconsin, and we look forward to continuing to ensure we get shots in arms as quickly, as safely, and as equitably as possible. And so now I'll hand it back to Elizabeth so we can take your questions.
Thank you, Deputy Secretary. And as we do take your questions, we remind you to maintain audio quality. Please remain muted until it's time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and unmute. And we begin today with Scott Bauer at the Associated Press.
Hi, thanks for doing this call. Can you give what advice you would have for people who are not on the priority list or not on the eligibility list yet, but want to make sure that they are notified when they are or when they get their place in line for when they can register for the vaccine for an appointment? What should those people do?
Thanks, Scott. There's a couple of things people can do. First of all, certainly watch our website. We'll be announcing the next eligibility groups very soon, and we'll be working with all of you, our friends in the media, to communicate that. So first of all, stay informed. Second of all, in terms of getting on a waiting list, as we open the Wisconsin vaccination registry system, which hasn't opened yet, but will later this week, you can certainly go into that system and register, and you will be put on a waiting list that once your particular eligibility becomes available, you will be notified that you could schedule at a clinic nearby. So that's one way. That registry will open later this week, and you can find that on the DHS website as well. And the last thing that I would say is if you are connected to a primary care provider, if you have a regular source of care, certainly call your physician's office and ask them what they are doing in terms of waiting lists or notifying their patients. Many of our healthcare systems already have a system in place, and so you may actually already be on a waiting list that you don't know about because your health system will notify you, particularly if you are a person with a comorbidity or one of the diseases that put you at risk, that you may very well be notified by your healthcare provider at the point in time that eligibility opens up to that group. So those are three things. Keep up to date on eligibility as it progresses, and announcements will be coming very soon. Second, visit the Wisconsin Vaccine Registry system, and you can register there. And third, check out with your own personal healthcare provider what they may be doing in terms of waiting lists.
Thank you for that. Let's go now to Madeline Anderson at Fox 6 in Milwaukee. Madeline.
Hi, you mentioned that the 47,000 Johnson & Johnson vaccine doses for next week will initially go to educators. I was just wondering how you think this will speed up the timeline for then when other people in phase 1B can begin to get the vaccine, because I know they are quite anxious right now. And then do you have an estimate for how many J&J doses the state will be receiving just on average? Will it be around the 47,000 mark or likely a lot more than that? Thank you.
Oh, I wish it was a lot more. It's going to be a lot less. It's actually what's going to happen initially. So your question is a great one, and let me give you a little bit more context behind this. So we learned we're getting 47 to 48,000 in this first tranche of J&J vaccine. And I think what this represents is the J&J vaccine that was already manufactured and was in the warehouse. The majority of the supply of that where the federal government is moving out to states and local vaccinators as quickly as possible. So what we have been told about J&J supply is we'll get this initial 48,000 doses, and then we're not likely to see very much supply for the next few weeks. And more likely by the end of March to start seeing a regular supply of vaccine. So it's really great news. It's great to have 48,000 doses here to get out. And that is partly why we decided let's get them to our educators. This is a group we've prioritized, and we know they are all eager to get their vaccines. And so we put them into our allocation for the school plan. And what you said is exactly what we anticipate happening. This is going to help us move through the educator workforce more quickly, and that will open up for others coming behind them. Those other groups we've outlined who are part of 1B, and the next groups that will be eligible very soon. So we'll use these 48,000 to really good use. Every dose, additional dose we get in the state is a dose towards our goal of moving through this group to the next group and ultimately to all the citizens of Wisconsin so we can achieve that 80% community immunity.
Thank you for that. Next question to Stephanie Haynes, TMJ4 in Milwaukee. Stephanie.
Hi there. Thanks so much for doing the call. My question is, what are your thoughts on grassroots groups making websites or social media groups to help people, help connect people with getting vaccine appointments?
I think every way we can help people connect to vaccine appointments is a great opportunity. And so as long as grassroots groups are using credible information to help people get to credible sites, I think that's an excellent use of resources. I know I saw a story about a group of teachers who were helping their friends and neighbors navigate the various registration sites and the various opportunities to get vaccine. And I think that's just the way neighbors help neighbors in our state, and really appreciate that.
Thank you for that. Let's give the next question to Stephanie Hoff at WisPolitics. Stephanie.
Hi, this is actually Adam Kelnhopper with WisPolitics.com. I'm filling in for Stephanie here. So we mentioned the 47,000 doses coming to Wisconsin for the Johnson & Johnson vaccine. Do we know how we got to that 47,000 number? Because based off of the state population for the overall 4 million or roughly 4 million Johnson & Johnson vaccine doses available, it should be around 69,000 for the Wisconsin population, which is about 1.8% of the total U.S. population. So I was wondering if you could comment on how we got to the 47,000.
So Adam, you'll probably not be surprised to know that I noticed that as well too. And so I think where the difference is the amount of vaccine that was allocated into the retail pharmacy program. So there are, the 48,000 that are coming to the state through our state allocation are ours to decide where they go. There's about another 15,000 that are going directly into the federal pharmacy retail program. I know that still leaves a couple thousand short, but it's much closer to the estimate that both you and I calculated off the 4 million. Dr. Schauer, do you know anything further about other places vaccine might be coming into the state?
Yeah, no, I think that those are the main pieces. We certainly have federal partners which receive vaccine that is not allocated through the state, like Department of Defense, Indian Health Services, and I'm not aware of how much they have been allocated, but that is also a piece of the puzzle with vaccine being administered here in Wisconsin.
Thank you for that. Let's go now to Lane Kimball, News 3 in Madison. Lane. News 3 in Madison. A reminder, *6 will mute and unmute your phone. News 3. All right, why don't we try to get back to that outlet, and let's go to Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thanks for holding this. I think you just mentioned that you're going to announce the next eligibility groups soon. Can you elaborate on that process? Are you planning to use SDMAC at all to come up with a phase 1C? Thank you.
Yep, we are using both the expertise that SDMAC has provided to us to date, the Advisory Committee on Immunization Practice, and the expertise of our chief medical officers to advise us on that next group.
Wonderful, thank you. Katrina Nickel, WLUK, Fox 11 in Green Bay. Katrina Nickel.
Hi there, good afternoon. My question is in regards to having 3 vaccines in the mix now for the state. How is distribution going to look adding this extra vaccine, specifically the J&J vaccine? You know, how the federal government will be shipping it directly to the vaccinators. You know, is the state going to have say in where that vaccine goes, or is it going to be up to the federal government? You know, what kind of criteria are you looking at to how to distribute these now different vaccines? Thank you.
Well, great question. And so the J&J vaccine will now become part of the state's allocation. As we've mentioned, there are different ways of vaccine getting distributed across the country. And there are several, like the Federal Retail Pharmacy Program and the programs that Dr. Schauer mentioned, like the Indian Health Service, the Department of Defense, the Federal Veterans Administration, where doses are shipped into our state directly allocated by the federal government. But the majority of doses that come into our state come to us in an allocation to the state health department to decide how to allocate across the various vaccinators in our state. And so J&J, the majority of the J&J vaccine coming into our state will come via that mechanism, just like we've received our proportional allocation of Moderna vaccine and Pfizer vaccine up until this point in time. So what will happen is just exactly the same process we've actually used with Pfizer and Moderna, is that vaccinators will indicate to us how many vaccines they're ready to distribute on a weekly basis. And we will run that through our formula that looks at a number of different factors, including population, and the social vulnerability index and geographic equity, and each vaccinator will be allocated a certain number of vaccines. Now, clearly this means that some vaccinators who have only been receiving one type of vaccine will now receive 2 types of vaccine. I think our vaccinators are ready, willing, and eager to accept this vaccine. As we've mentioned, it's much easier to store. It goes right into the refrigerator, not even a freezer. And it's 1 dose, so they don't even have to track for that follow-up second dose. So I think this is an easy new vaccine to add into the mix. We already have a number of vaccinators who are using both Pfizer and Moderna, and so they've already demonstrated to us that they can manage 2 different vaccines. And likewise, we know some of them will now add a 3rd to their mix. We also already have experience with shipping directly to vaccinators. The Moderna vaccine ships that way. It is only the Pfizer vaccine that we have to send to our central hubs and redistribute. So this is building on all the good work our vaccine team has done to manage the logistics of vaccine and the distribution of vaccine. And as our federal partners have said, you know, we now have 3 great vaccines in our arsenal to fight this, and we will get them out equitably and across the state to all of our vaccinators to make sure that we accelerate the number of people in our state who are protected from COVID-19.
Thank you for that. Let's go now to Brittany Schmidt, WBAY in Green Bay. Brittany Schmidt.
Hi, my question is, so with the Johnson & Johnson, we know that the efficacy is a little bit lower than the Moderna and Pfizer vaccine. And so a question that we've received is if people get the Johnson & Johnson vaccine, let's say now, and then in 10 months when vaccines are readily more available, there's more supply, could people then go back and get the Pfizer or Moderna series vaccines? Because we know there's two different scientific methods for, mRNA and then the adenovirus. So can anybody speak to that?
Great. Dr. Schauer, would you like to respond to that question?
Sure, certainly. So, we do continue to follow the Advisory Committee on Immunization Practices and their recommendations. So would they go and recommend that, we would certainly follow their lead. I think it's important to note that right now, as we look at these vaccines, that all three of them really have equal or very good protection, and there's really no difference between them when it comes to prevention of severe disease, hospitalization, and death. That's the really important piece that we want people to feel reassured about, and ensure that when it comes time for them to be vaccinated, that they go ahead and they step up and receive whichever vaccine is available and not to shop around. So I think, even Dr. Fauci noted not to get too wrapped up in some of those initial numbers, but really to look at that final result, and all three vaccines are certainly considered safe and effective.
Thank you for that. Let's go now to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Yeah, thanks for taking my question. What does it mean for the Johnson & Johnson vaccine to be one dose? What will a single dose vaccine, how will that help logistically speaking in getting as many people vaccinated as possible? Thank you.
So Rob, great question. And just think about this. If you have 100 million doses of J&J vaccine, which is what J&J has promised the federal government by the end of June, that means you have 100 million people fully protected against COVID-19. If you have an equal number of doses of Pfizer or Moderna, 100 million of either of those, it only means 50 million people will be fully protected, because it takes 2 of those doses to protect each person. So the simple math means we're going to get there faster with a 1-dose vaccine. The second component of that is just think about how much easier it is for everybody. I mean, I don't know about you, but I'd rather go to the clinic once versus twice. I'd rather only have 1 shot versus 2. I mean, of course, I'll take, when my number comes up, and if it's Pfizer, I'll take Pfizer and go for my 2 shots. If it's Moderna, I'll go for the Moderna and take my 2 shots. And if it's J&J, I'll take my 1 shot. But, it's a lot easier for a lot of people to only have to visit the clinic once and to have that 1 shot. If you're really afraid of vaccines or needles in your arm, 1 shot's better. So all of those things make this 1-dose series better for so many people. But I think it's the pure math that makes it the best, which is 100 million doses means 100 million people protected.
Thank you for that. Next question to David Wahlberg, Wisconsin State Journal.
Yeah, thank you. A few weeks back, you were pointing out that the CDC data on vaccinations lagged behind Wisconsin's data, but now it seems like the opposite is the case. The CDC actually says that Wisconsin has given more vaccinations, and you vaccinated a higher percentage of the population than what DHS says. Can you explain the difference, and which set of data should we be looking at?
So I can explain the difference. At least let me begin, and I'll turn to Dr. Schauer as well. So one of the major differences of what has happened over a very recent period of time is that CDC has begun to add in those allocations that are coming through those direct federal sources that we mentioned earlier. So now vaccines that are being allocated to Wisconsin through the Indian Health Service, through the Veterans Administration, through the Department of Defense, through the Federal Retail Pharmacy Program, those allocations are all included in the CDC data. And likewise, so are the vaccinations reported in the CDC data. In the Wisconsin data, the allocated and distributed numbers only include those doses that are coming through the state allocation. The doses administered to Wisconsin citizens is a mix, because some of those partners are using the Wisconsin Immunization Registry, for example, Walgreens, who is part of the retail pharmacy program, and a number of our state's tribal nations use the Wisconsin Immunization Registry. So their doses are counted even if they're coming through the federal allocation, whereas others, like the Veterans Administration, does not use WER, and so it does not include those parties. So I think that's most of the explanation, but Dr. Schauer, anything you would add or provide further clarity on?
Yeah, no, I think that's exactly it. I would say, as noted, there was a discrepancy earlier on where we were lower, and we worked with our CDC partners to determine where the issues were, and we have been able to rectify that. So that was the one part of the correction, and then the addition of all of these federal partners and the information, as Deputy Secretary just explained, is the other half of the story.
Yeah. Thank you for reminding us that there was a discrepancy in our data as well, too, that's been corrected.
Thank you both for that. Let's go now to Terry Sater, WISN in Milwaukee. Terry. WISN, a *6 will mute or unmute your phone.
Yes, can you tell us what problems you're experiencing getting the COVID-19 vaccine registry up online? Your earlier information said it was supposed to be up and running yesterday. Are you experiencing some challenges with the registry?
Yeah, as we've told you, this has been on a really tight timeline, and we've been working right down to the wire with our colleagues at Microsoft. And so as we went into piloting and testing the system with a number of our local partners and our team here at DHS, late last week and over the weekend, we ran into some components that were not functioning the way we anticipated. Rather than roll the system out with any potential bugs in it, we've worked very closely with Microsoft, who has been busily making fixes to the system, and we've been retesting it and checking those modified programming changes over and over again, because what we want is when we release it both to our local health departments for use and most certainly to the public, as we want it to be completely functional. So we made the decision that quality trumped speed in this one. It'll be a few more days. We're not long away from that. We have, again, really great local partners who are eager to test this and use it in their clinics. And so I anticipate later this week, probably on Friday, some of those sites will start to go live. I know our state site may do that, at the Rock County site may do that a few days earlier. The other thing I want to say is this goes to the question that Scott asked at the beginning of the briefing, which is many of, almost every one of the departments, the local departments we're working with have waiting lists. And so we've been working very close. Part of this delay has been working with Microsoft to have a way to import those waiting lists into the system so that we can do push notifications to the people who are on the waiting list to get them appointments before we open this system up broadly to the public. So while we're celebrating more vaccine coming into our state today and the opportunity that we're going to move a little faster, we all need to remember we're still dealing with far more demand than we have supply. And so we're trying to manage that in a very methodical way and to make sure those who have raised their hand, who are eligible, who have been patiently waiting, get their opportunity for vaccine first before we open the system to the general public. So that's been one of the key elements of why it's taken a little bit longer, because that was not in the standard package that Microsoft offered to us. And we asked them to make this change in order to honor our citizens in this way as we move the package out.
Thank you for that. The next question to Bridget Bowden, Wisconsin Public Radio. Bridget, Wisconsin Public Radio. All right, let's try to get back to Bridget, and we'll go to Georgina Fernandez, WJFW in Rhinelander. Georgina at WJFW.
Hi, thank you for taking the time to answer this question. But I was wondering, we kind of talked briefly about this, but with teachers and the new group now, they are kind of first in line to get those Johnson's vaccines. But if they're wanting to get Moderna and Pfizer, is there a way they're able to get those vaccines? Or right now, are these the primary just getting those J&J vaccines and wouldn't get a chance to choose?
Well, here's the deal, Georgina. When, we again are in very limited supply of vaccines. So what I would say to everybody who's receiving vaccine right now is accept the vaccine that you are offered. If for some reason you have a very strong personal preference for one type of vaccine over another, it's probably wise to check with your provider, who's ever providing your vaccine to you, to ask them what they're using. And know that if you say no, thank you, you'll just have to get in a different line and wait longer. But right now, we've got 3 great vaccines. We've got them distributed across the state, and they are all effective, as Dr. Schauer pointed out, in preventing hospitalization and death and severe disease. And so we encourage people to take the vaccine that is offered. I do want to clarify, we are not only using J&J for vaccinators. We are also using Moderna and Pfizer. So it isn't that vaccinators will only have J&J, but it will depend which vaccine we send to which community, to which school district. They have a fairly equal chance of any of them at this point in time.
Thank you for that. Let's go now to Danny Maxwell at WKOW in Madison. Danny Maxwell. WKOW in Madison. All right, we'll try to get back to Danny, and let's go to Latoya Dennis, WUWM Milwaukee. Latoya Dennis. Milwaukee NPR.
Yes, can you hear me?
Yeah, we can hear you. Go ahead.
Thank you for taking my call. I'm wondering how you go about building public confidence in the Johnson & Johnson vaccine. As has been noted on this call, there are concerns about this one.
Dr. Schauer, would you like to begin with that?
Yeah, sure. I mean, I think it's important to remember that all of these vaccines have gone through rigorous testing when it comes to safety and efficacy. There's a number of reasons why it seems to be on an accelerated schedule, but to be reassured that all of these vaccines have gone through the necessary steps and through the different phases of the clinical trials for both safety and efficacy. And there's a number of reasons why there have been some of the trials or the groups have been overlapped. We've seen they have enrolled larger numbers of individuals to be able to get more information more quickly. And so I think it's important that people understand that there haven't been any corners cut with any of these vaccines. They have been going through really fair, transparent processes. The information has been presented and available in terms of the data to evaluate ahead of the meetings that the FDA is holding, that the ACIP is holding their meetings, and that these are televised and people can listen in. So I think really reassuring people about the process that all 3 of these vaccines have taken. Also remember that these have been tested on over 40,000 individuals each at the very minimum in several countries, and they continue to be evaluated and studied for both safety and efficacy. That information continues to be reported on. There was an MMWR that was just published. That's the Morbidity and Mortality Weekly Report. that was just published about sort of the first month or month and a half about the safety profiles that came from the vaccine adverse event reporting system, as well as the vSafe. And that information is reassuring. It backs up what we saw in the clinical trials, that things like headache and fatigue and I think dizziness and some redness and swelling at the injection site were the most common side effects, that they were self-limiting 1 to 2 days. And so that kind of information, we continue to see the publications come out about these vaccines and really be reassured. And so that folks understand this isn't sort of once it receives that authorization that we're done with it, that we continue to learn more about it and that we see that information coming and continue to evaluate and ensure that they are safe and they are effective. And as I said, this is the same process, no matter if you're talking the mRNA vaccines, whether you're talking about the Johnson & Johnson vaccine or anything else that's in the pipeline.
Thank you, Dr. Schauer. And I would just add also that I know some folks are concerned because they hear the J&J vaccine is 68 to 72% effective in preventing any disease as compared to a 90 to 95% effective with the Moderna and Pfizer. And a couple of things that I would add to what Dr. Schauer said about that. First of all, that's the same kind of range we see in effectiveness of our normal childhood vaccines as well, too. There are vaccines that are closer to 70%. There are vaccines that are 90% plus. So this is a very normal range for vaccinations. And honestly, if J&J had come out first with that kind of effectiveness, we all would have been blown away. We would have been so thrilled for it. So they are both very, very effective at preventing illness. And as Dr. Schauer said, I really think it's important for us to focus on, they are equally effective at preventing serious illness, hospitalization, and death. And that is the ultimate outcome that is most important to protect against. And they are all equally effective in that regard. So there's a well-rounded response from both of us about how we're thinking about those vaccines as well. So.
Thank you for that. A well-rounded response. We go now to Ben Boken, NBC 26 in Green Bay. Ben at NBC 26.
Hi, yes, my question is regarding the investigations going on throughout the state, specifically 584 active investigations with educational facilities. Obviously, the data wasn't updated. It hasn't been updated since February 24th, but my question really is what does that mean? What does investigations mean? And also, what does that include? Colleges, high schools, so on. Thank you.
Could you, Dr. Schauer, okay. Could you say a little bit more about what you're referring to? Are you talking about outbreak investigations, sir?
Yes. So it's
okay.
So, for example, like the facility-wide COVID-19 public health investigations. Yes.
Got it. Thanks. I always tell my public health friends that word investigation brings up some other thoughts in terms of criminal investigations, and so just wanted to clarify. Yes. So a normal part of our COVID response is that we do what are called disease investigations. That's basically the interview we do with anybody who's COVID positive, and when we find clusters of COVID cases, 1 or 2 or more in a given facility. It depends on what kind of facility that defines how many cases precipitate an outbreak investigation in that facility. We follow up. And so we have done this for over a year. Anytime we see an outbreak in a facility, we do that in long-term care facilities, we do that in businesses, we do it in schools and educational settings. And so, what I can tell you generally about the investigations that have been done in educational settings is when we see 2 or more cases, we follow up with that institution. We look for additional cases. We provide, well, first of all, let me say this. We being the public health system, and this is work that is done at the local level. The local health department follows up with those institutions and provides technical consultation and assistance and guidance around, first of all, how to ascertain how many people are affected, how many people should be in quarantine because they've been close contacts to cases that are infected, and then what kind of additional steps may be taken to protect people in the setting. So, for example, in an educational setting, it may very well be working with that school or that school district and reviewing all of the kind of safety guidance that's outlined in the CDC guidance that has been present since the beginning, but was reissued a week or 2 ago. So helping them think through things like, how are you doing with your mask policy in schools? How are you helping kids remember to keep their masks on? How are we keeping groups of kids in cohorts and not intermingling across the school? How are we performing good hygiene and good environmental controls? How are we maintaining physical distancing in the classroom? Looking at class size and arrangement of students in the classroom. So providing that kind of consultation in response to any kind of outbreak in a school helps everybody just review the basics and think about how we can do things even better. The good news is that the great majority of the investigations we have done in schools have been very, very small. There has not been lots of spread in school settings, and almost, not zero, but a very small percentage of it has been in the classroom itself. Much of it, when you do that kind of investigation, has been linked to either contact among students in extracurricular activities or out of school activities like play dates, sleepovers, backyard barbecues when the weather was nicer. And so when schools implement those 5 strategies outlined in the CDC guidance, it has been shown that transmission in school settings is very low. And the good news is we have 2 additional strategies that CDC outlined that they call layering strategies. One is the implementation of testing in schools, particularly for symptomatic children or staff. And then, of course, the second is immunization, which is, as we've talked about today, a strategy that we're assisting with school districts all across the state.
Thank you for that. The next question goes to Emily Davies, WSAW in Wausau. Emily, WSAW.
Hi, you kind of answered this question a little bit already, but I just kind of wanted to go into it a little bit further in regards to the distribution of all of the different vaccines. So with the Johnson & Johnson being a little easier to get to people, they only have to go one time. Is there going to be, is the state going to be looking at areas that might not have as easy access to, or places maybe that are lower income or things like that, where the Johnson & Johnson vaccine will be taken, I guess, a more priority to? And I guess, how are you going to also avoid that, or make sure that it's equitable for the vaccine distribution that way? Thanks.
Yeah, I think, your question raises some very good points, that there are some populations that might be really good focus groups for this vaccination. But we'll consider that as we move down the line and we see what the supply is and we see what the opportunities are. For right now, we're mixing it into the supply with Moderna and Pfizer. Again, we just want to be moving vaccine to our currently eligible groups as fast as we can, and again, in as equitable a fashion as we can, to to make sure that everyone who is currently waiting for a vaccine can get a vaccine as soon as possible. So that's our current approach. And as we move down the line, there may be places where it seems like it may be a more judicious use of the vaccine in certain settings, and we'll certainly consider that, especially as requested by vaccinators as they've worked through those kind of decisions with folks in their own communities. It really isn't the state's role to decide that for local communities. We've set up a system where we really want local communities leading on how they deploy their vaccination effort, and we're here to support that.
Thank you for that. The next question to Eric Gunn at Wisconsin Examiner. Eric Gunn.
Hi, thank you for taking the question. I don't know if you saw the poll that came out yesterday. It was in the Hill from Harvard and the Harris Organization, that 59% of those surveyed were willing to receive a vaccine, 41% were not willing. So I'm wondering whether DHS and how you may be attempting to measure the percentage of people in the state who are declining the vaccine, and what plans there are to try to make that calculation, and if you have a current best estimate for that percentage in the state as of this time, and what would be the day-to-day impact if the number of people in the state getting the vaccine doesn't rise above, say, that 60% number? Thank you.
Well, I'll start with a couple of things, and then I'll turn to Dr. Schauer, because I know she's done and her team have done a lot of thinking about how we encourage people to consider vaccines. So first of all, I didn't see that poll recently, but I'll tell you that's better. That's improving. Most of the polls I've seen before that, Eric, were more like 50% saying they'd get it. So we've already jumped up to 59%. So I think that's good. I also think the 41% are probably not all 41% hard nosed. They are people who are still, a portion of them are. There is a portion of our population we know are never going to accept this vaccine. They may very well not accept other vaccines, but there is a portion in that 41% who are still considering. And so that's where our efforts are really, really important. And so I turn it over to Dr. Schauer to talk about what we're seeing and how we're addressing that 41% who still hasn't made the decision to say yes quite yet.
Yeah, and I think that's really, you've hit the nail on the head, is that 41% often, as we're hearing, is a number of folks who may have taken a wait and see approach and their actions are sort of saying, well, I'm going to delay and wait and see. And we know studies are showing that if they know someone who has been vaccinated, that experience and recognizing, so they've received the vaccine, they may be more likely to go ahead and then step up to the plate and receive their own vaccine once they see the experience of someone that they know and trust. Additionally, the recommendation from a family physician or someone that they know and respect about the immunization is also a key piece. And so thinking about those things, I think we will see as more and more individuals are vaccinated, that we will see folks move towards, and they may have decided, perhaps I wasn't somebody in that first month, but I'm now stepping up. We are seeing this happen in the skilled nursing and assisted living facilities, whereby this is with the pharmacy partners where they are going into these facilities 3 times. And we are seeing the number of first-time recipients at sort of second and third dose clinics increase. So people may have bypassed their opportunity at that first time that they were offered vaccine, but at that second or third time that they are stepping up and being vaccinated. So I think that is certainly encouraging. To the point about ensuring that message is coming from a trusted source, we've mentioned before is there's a request for applications for community-based organizations who wish to provide education and outreach into different communities throughout Wisconsin, and really wanting to support the voice and the messages of vaccine coming from within the community and not just from sources like local public health. They certainly are important, but it's important that we have a variety of messengers. And so to that end, we continue to support local efforts and others. Lastly, we are continuing to make sure that our vaccinators have the information that they need so that they can answer the questions for their patients about the vaccine, and make sure that folks feel reassured about making the decision to be vaccinated. So being able to have the conversation and answer the questions about, well, what does this mean? Or I've heard X, Y, and Z, and being able to reassure that these vaccines are safe and effective so that people feel comfortable making that decision to move into the I've been vaccinated group.
Thank you for that. The next question to Taj Mahal, WMTV in Madison. Tajma. WMTV in Madison, *6 will mute and unmute your phone. All right, we'll try to get back to NBC. We'll go to Sophie Carson, USA Today Network, Wisconsin. Sophie Carson.
Hi there, thanks for taking my call. My question's about the variant cases. If you look at the CDC's tracker of variant cases, neighboring states have identified many more cases than Wisconsin. Like Michigan has found more than 400. So do you think Wisconsin labs need to be performing more genome sequencing on more test samples, or is it just that the variant outbreak maybe hasn't hit Wisconsin yet?
Well, Sophie, it could be either. I think it's important to remember that it is a very small percentage of cases that are actually undergo the genomic sequencing in order to identify the variants. What I can tell you, however, is that Wisconsin actually is doing a fairly high number of those of sequencing. Again, we'd have to get the exact percentage to you, and our staff can certainly check and get that number for you. I don't want to misspeak, but I do know in talking with our Bureau of Communicable Disease that Wisconsin actually ranks fairly high in the number of variants that we do sequence. The Wisconsin State Lab of Hygiene has been a leader in that, and I know we have a number of other labs throughout the state. But it is still a fairly small percentage. This is not like every time there's a COVID test done, there's genomic sequencing done. So there isn't a definitive answer to that because of that. I hope it's because we are seeing fewer variant cases. Some of the other data at this point supports that. Certainly our case numbers are not rising rapidly, although our descent in the number of cases has stalled at around the 600 cases per day level for much of the last week or so. But we are not seeing subsequent rises in hospitalizations. In fact, our hospitalizations are under 300 cases for the first time in months. I believe we were at 287 yesterday, people in our state hospitalized, and only 79 of those who were in ICUs, so that's good. And our death numbers are at around 18 deaths per day average. Again, similar to the case numbers, that decline in deaths has stalled around that level. So that stalling of cases, of the decline of cases, is something that is of concern to us. We would like to see that number continuing to decrease, especially as we vaccinate more people. And so that flatlining of that could also be an indicator that we have some level of variance in our state. As Dr. Walensky from the CDC has said, now is not the time to become complacent about our mitigation efforts. We're really on a race against the clock, against the variants. You know, I was thinking about this the other day, and I thought maybe there's an analogy with if you've ever had surgery, you know, and you have surgery and you feel, you know, it's tough, right? You feel really, you've got pain, you got fatigue. Depending on what kind of surgery, you may have other symptoms as well. And then there comes that day, several weeks after the surgery, where you feel really good. And so you're like, yay, I'm over the hump. And you go out and you take a walk and you do lots of things and are very active physically. And the next day you wake up and you feel like you got run over by a truck. I think that's where we're at in the pandemic. We're on, you know, we're potentially at that day you feel really good. And we want to go back to doing everything like it was. And the fear I have for us is if we do that, that in a week or two, we could get run over by feel like we got run over by the truck again if we see a sudden surge in cases. So we don't want to take one step forward like we are with this great work that's happening with vaccination and the great patience that Wisconsinites have had with wearing their masks and physical distancing and keeping their social circles small. You know, we've made 1, 2, 3 steps ahead. We do not want to take 5 or 10 steps back. And so even though we are testing, we haven't had a lot of variants, I would say let's hang on. Let's get through March. Let's get through April. Let's get these additional doses that are coming into people's arms. Let's get that rate of vaccination up. Let's get spring to come so we can still see, you know, do a lot of our socializing outside. And I think we could be in a very different place come early summer, early June, than we are now. But we don't want to go back and have to deal with a third huge surge in cases, which along with it will come many hospitalizations and many deaths of people that don't have to die. If we can just be patient, keep up our prevention behavior for those of us who are still waiting for vaccine, go in and get our vaccine if we're eligible, whether you're in the 59% who are raising your hand right away or whether you're in the 41% who are still considering. And if we can get to early summer with doing all of those things, I think we're going to be in much better shape than we are even today.
Thank you for that. Let's go now to Tyler Jobe, WKBT in La Crosse. Tyler, WKBT.
Yes, thanks for taking my call. I'd like to focus on teachers' vaccinations. So I'm just wondering if are there certain schools in Wisconsin that are a top priority to get the teachers vaccinated? And also, where do La Crosse area schools rank in that priority list? Thank you.
Yeah, so I talked about the ranking of schools last week, and the good news is we haven't had to use that ranking because once we received all of the plans from the school districts via the local health departments across the state, we found that based on when health departments and school districts had agreed upon when they wanted to start their vaccine, which goes to a lot of things. It goes to schedules, it goes to when spring break is scheduled. We had adequate vaccine, especially with this infusion of this additional 48,000 doses, that we could meet everybody's first request. So we did not have to use that ranking. That would have been kind of the tiebreaker on things if we hadn't had adequate supply. And with this infusion of vaccine and with saving that portion of growth in vaccine for educators that we talked about last week, we have adequate vaccine for all of the plans that we have now to begin vaccine in the month of March. The other exciting thing we found out as we asked school districts for their plans is that our local health departments indicated that there were 131 public school districts across the state that already planned to be done by March 15th. The first week would be sending this vaccine out. And so those are places where either their partner providers have said, we're going to use our allocation, either a health system or a pharmacy to vaccinate schools, or the allocation coming into the health department was sufficient to address the schools in their community. So that's a really great head start. That's over a quarter of the public school districts in the state. And so, you know, we feel really great about the way this all timed out, about the excellent information that our school districts and health departments provided us, about the way we were able to carve out this new influx of vaccine and add it to the supply we'd already identified. And as we talked about earlier, the good news is we'll get our teachers vaccinated quickly, and by doing that, it also opens up the vaccine pipeline for others in this eligibility group and those who will soon follow. In terms of the exact days and weeks when districts will be vaccinated, we're just putting the finishing touches on the master plan for that, and we'll be releasing that plan in the next few days.
Wonderful. Thank you for that. Now to Julian Emerson, Up North News. Julian, Up North News.
Thank you for taking my call. I've been receiving calls in recent days from folks with chronic health conditions asking and wondering about when they may be eligible to be receiving the vaccine. And I'm wondering, are some of those people part of the additions made yesterday to Group 1B, and how soon could those people begin getting the vaccine?
Yeah, people with other chronic health conditions are not part of the group we added yesterday, but they are part of the group that we are considering for the next phase. And so just like the CDC included that group as part of phase 1C, which would be the next group we'd be having come into the vaccine eligibility pipeline, we are giving very serious consideration to people with other chronic health conditions for that phase. And as mentioned earlier, we'll certainly be providing more information about upcoming phases very soon.
Thank you for that. The next question, the final question, to Asal Razai, Spectrum News. Asal, Spectrum News. *6. Oh, I think I hear you.
Hi, I'm just wondering, I know there's been a couple of timelines that you've mentioned, but any idea of how long it may take for us to get through 1B?
Yeah, always a good question and always a little hard to answer. You know, what we have estimated at the beginning of 1B is about 2 months, but that could be shorter. I don't think it's probably going to be longer, but it could be shorter based on a couple of things. One, which would be a bad thing, is if a whole bunch of people in 1B didn't want vaccine. And so it depends on the acceptance rate. I hope it takes a long time based on that, because I want 100% of the newly eligible group to accept vaccine. The second thing that could make it shorter would be more vaccine. And so again, this new approval of Johnson & Johnson is already a step in the right direction. Using the 48,000 doses that are coming into the state allocation for educators will help with that. And it will, we don't yet know how many more doses will become part of the mix later this month or into early April, but that certainly will help because those doses were not estimated at the time we were saying 2 months. So more vaccine will certainly help. So, you know, we have to wait and see. And after we've had a couple of weeks in any new phase, we've got some further data seeing how acceptance levels are going and how our vaccinators are doing with finding the eligible population and vaccinating them. And so we'll be in much better position to re-estimate how long it might take and when we might be able to have the next group of 1C begin, usually after we've had a couple of weeks of experience in a new phase.
Thank you for that. Let's try to get to some of the reporters who were not available when called on. News 3 in Madison. Lane Kimball, News 3 in Madison. Wisconsin Public Radio. Bridget at Wisconsin Public Radio.
Group of congregate living facilities. Are there any prisons that are going to be receiving doses at this time?
Bridget, you cut out right in the beginning, but I think your question primarily was, are there any prisons who will be receiving doses at this time?
Yes,
Is that correct?
correct. Sorry about that.
Yes. Yep. No problem. Just wanted to be sure I was answering the correct question. Yeah. At this point, the doses that have gone into the correctional system have primarily been used to vaccinate staff and people who were eligible with, based on 65 or older, but there have been no further doses allocated for other people in that congregate setting at this point in time.
Thank you for that. Danny Maxwell, WKOW. WKOW in Madison. All right, how about Taj Mahal, NBC 15 in Madison? Taj Mahal. All right, well, with that, we will conclude today's briefing. We want to thank Deputy Secretary Julie Willems Van Dijk, Dr. Stephanie Schauer, and of course, all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.